Hi there, this is Tan, and welcome to my channel. CDC monitoring reports of myocarditis and pericarditis. CDC has received increased reports of myocarditis and pericarditis in adolescents and young adults after COVID-19 vaccination. The known and potential benefits of COVID-19 vaccination outweigh the known and potential risks, including the possible risk of myocarditis or pericarditis. We continue to recommend COVID-19 vaccination for anyone 12 years of age and older. Different COVID-19 vaccines. The best COVID-19 vaccine is the first one that is available to you. Do not wait for a specific brand. All currently authorized and recommended COVID-19 vaccines are safe, are effective, and reduce your risk of severe illness. CDC does not recommend one vaccine over another. Vaccine brand name: Pfizer-BioNTech. Who can get this vaccine? People 12 years and older. How many shots you will need? 2 shots given 3 weeks, 21 days, apart. When are you fully vaccinated? 2 weeks after your second shot. Vaccine brand name: Moderna. Who can get this vaccine? People 18 years and older. How many shots you will need? 2 shots given 4 weeks, 28 days, apart. When are you fully vaccinated? 2 weeks after your second shot. Vaccine brand name: Johnson & Johnson's Janssen. Who can get this vaccine? People 18 years and older. How many shots you will need? 1 shot. When are you fully vaccinated? 2 weeks after your shot. If you have had a severe allergic reaction, anaphylaxis, or an immediate allergic reaction to any ingredient in the vaccine you are scheduled to receive, you should not get that vaccine. If you have been instructed not to get one type of COVID-19 vaccine, you may still be able to get another type. 2. You should get your second shot as close to the recommended 3-week or 4-week interval as possible. However, your second shot may be given up to 6 weeks, 42 days, after the first dose, if necessary. Vaccines in Phase 3. Clinical trials as of February 27, 2021. Large-scale, Phase 3, clinical trials are in progress or being planned for 2 COVID-19 vaccines in the United States. AstraZeneca COVID-19 vaccine, Novavax COVID-19 vaccine. COVID-19 vaccine clinical trials, including vaccines in earlier stages of development, by visiting Clinical Trials, Gov external icon. Understanding how COVID-19 vaccines work. Updated May 27, 2021. What you need to know. COVID-19 vaccines are safe and effective. You may have side effects after vaccination, but these are normal. It typically takes 2 weeks after you are fully vaccinated for the body to build protection, immunity, against the virus that causes COVID-19. If you are not vaccinated, find a vaccine. Keep taking all precautions until you are fully vaccinated. If you are fully vaccinated, you can resume activities that you did prior to the pandemic. The immune system, the body's defense against infection. To understand how COVID-19 vaccines work, it helps to first look at how our bodies fight illness. When germs, such as the virus that causes COVID-19, invade our bodies, they attack and multiply. This invasion, called an infection, is what causes illness. Our immune system uses several tools to fight infection. Blood contains red cells, which carry oxygen to tissues and organs, and white or immune cells, which fight infection. Different types of white blood cells fight infection in different ways. Macrophages are white blood cells that swallow up and digest germs and dead or dying cells. The macrophages leave behind parts of the invading germs, called antigens. The body identifies antigens as dangerous and stimulates antibodies to attack them. B lymphocytes are defensive white blood cells. They produce antibodies that attack the pieces of the virus left behind by the macrophages. T lymphocytes are another type of defensive white blood cell. They attack cells in the body that have already been infected. The first time a person is infected with the virus that causes COVID-19, it can take several days or weeks for their body to make and use all the germ-fighting tools needed to get over the infection. After the infection, the person's immune system remembers what it learned about how to protect the body against that disease. The body keeps a few T lymphocytes, called memory cells, that go into action quickly if the body encounters the same virus again. When the familiar antigens are detected, B lymphocytes produce antibodies to attack them. Experts are still learning how long these memory cells protect a person against the virus that causes COVID-19. How COVID-19 vaccines work. COVID-19 vaccines help our bodies develop immunity to the virus that causes COVID-19 without us having to get the illness. Different types of vaccines work in different ways to offer protection. But with all types of vaccines, the body is left with a supply of memory T lymphocytes as well as B lymphocytes that will remember how to fight that virus in the future. It typically takes a few weeks after vaccination for the body to produce T lymphocytes and B lymphocytes. Therefore, it is possible that a person could be infected with the virus that causes COVID-19 just before or just after vaccination and then get sick because the vaccine did not have enough time to provide protection. Sometimes after vaccination, the process of building immunity can cause symptoms, such as fever. These symptoms are normal and are signs that the body is building immunity. Types of vaccines. Currently, and recommended or undergoing large-scale, Phase 3, clinical trials in the United States. Below is a description of how each type of vaccine prompts our bodies to recognize and protect us from the virus that causes COVID-19. None of these vaccines can give you COVID-19. mRNA vaccines contain material from the virus that causes COVID-19 that gives our cells instructions for how to make a harmless protein that is unique to the virus. After our cells make copies of the protein, they destroy the genetic material from the vaccine. Our bodies recognize that the protein should not be there and build T lymphocytes and B lymphocytes that will remember how to fight the virus that causes COVID-19 if we are infected in the future. Protein subunit vaccines include harmless pieces, proteins, of the virus that causes COVID-19 instead of the entire germ. Once vaccinated, our bodies recognize that the protein should not be there and build T lymphocytes and antibodies that will remember how to fight the virus that causes COVID-19 if we are infected in the future. Vector vaccines contain a modified version of a different virus than the one that causes COVID-19. Inside the shell of the modified virus, there is material from the virus that causes COVID-19. This is called a viral vector. Once the viral vector is inside our cells, the genetic material gives cells instructions to make a protein that is unique to the virus that causes COVID-19. Using these instructions, our cells make copies of the protein. This prompts our bodies to build T lymphocytes and B lymphocytes that will remember how to fight that virus if we are infected in the future. Some COVID-19 vaccines require more than one shot. To be fully vaccinated, you will need 2 shots of some COVID-19 vaccines. 2 shots. If you get a COVID-19 vaccine that requires 2 shots, you are considered fully vaccinated 2 weeks after your second shot. Pfizer BioNTech and Moderna COVID-19 vaccines require 2 shots. Johnson & Johnson's Janssen COVID-19 vaccine only requires 1 shot. If it has been less than 2 weeks since your shot, or if you still need to get your second shot, you are not fully protected. Keep taking steps to protect yourself and others until you are fully vaccinated, 2 weeks after your final shot. Thanks for watching. Please subscribe to my channel. Don't forget to subscribe.